Welcome, everyone. Please, in the chat box, if you're able to, just introduce yourself, state where you're from, which organization or company you work for, and where you're based. And that way we know a little bit about you. And we will be starting in just about now. My name is Alexandra Schiller, and I'm going to be your moderator for today's session. Welcome to the official launch of Rore, which is also known as the Responsive One Health Resource Engine. I serve as a One Health Research Associate at the One Health and Development Initiative, where I've had the privilege of working at the intersection of public health, environmental sustainability, and animal welfare. Over the past several months, I've been deeply involved in the development and the stakeholder engagement for Rore, and I'm thrilled to help unveil this platform for you today. So why are we here? The launch of Rore marks an exciting milestone in advancing real-time, accessible, and multilingual support across the One Health spectrum. Rore is more than just a chat box. It's a dynamic tool built to bridge information gaps, support coordination, and empower people, communities, professionals, researchers, and policymakers with timely, context-appropriate guidance across the animal, human, and environmental health sectors. So today's session will give you an inside look at how Rore works, the vision behind its creation, and its potential to transform One Health collaboration globally. You'll hear today from Dr. Kiki, the organization's director and the creator for Rore, and have a chance to ask your questions. Before we get started, just a few housekeeping notes. Please keep yourself on mute throughout the session unless you're invited to speak to help us avoid any background noise. If you have any questions during the presentation, feel free to drop them in the Q&A chat box at any time, and we'll be addressing them throughout the session and as well as the Q&A section later on. And lastly, this session is going to be recorded so we can share it with others who could not attend today. And thank you all so much for attending. We're so excited to have you and to share this moment with you. And thank you for joining us in this next step towards more integrated, responsive One Health solutions. So I will stop talking and I will let Dr. Kiki take it from here.
Yes, thank you, Alexandra. Let me share my screen very quickly before we start. First of all, thanks to everyone who is joining in today. We appreciate you taking out your time to learn more about something that we are so super excited about at OHDI, something that we've been working on for months, something we have been, it started as an idea, it started as something that we just something that we thought of. And now it's amazing to see how this has really materialized and has become something of reality. It's like being pregnant with a baby and then having to see it born. And now that it's born, we now want to watch it grow. So it's a very, very wonderful time for us at OHDI. We've been working as a team to get this on board, and I can't wait to share it with all of you. So let's get started. So we're going to be talking about a tool called Rore, the One Health Companion, or your One Health Companion. What exactly is this about? It's a tool that is currently available at www.askrore.com. And the goal of this presentation is for us to share this with you, to take us through the journey of how it was developed, why it was developed, and what exactly are the plans, what exactly is the vision moving forward, and what do we expect to achieve. So I think the first thing I want to talk about is a little bit of our organization, because Rore started from something that we have realized out of the myriad of activities that we've been doing at OHGI, our engagement with communities, with response to zoonotic diseases, with supporting farmers on the field, with doing advocacy and media engagement, community engagement on various One Health issues. It came as a result of one very critical gap that we saw in these areas. Now, One Health and Development Initiative is an organization that was established in 2019, and the goal was very simple. We want to implement the One Health approach. We want to operationalize the One Health approach. The goal was for us to address interrelated issues of human, animal, and ecosystem health using the One Health approach. It was very clear what exactly was established for, and we have been doing this over the last 5+ years now, since we started official operations in January 2020. And because we do work with the One Health, framework, we work around quite a myriad of issues that are standalone, but yet very, very interconnected. So we work in the area of public health and health security when it comes to prevention and, response to zoonotic diseases in communities and also in farms. We work on AMR mitigation. We do a lot of work around food safety, in this case, most importantly in abattoirs. We've done work in abattoirs before, and also some awareness, community engagement of food safety. We do a lot of work around animal welfare, particularly farmed animal welfare. We've done quite extensive work with poultry farmers and fish farmers within Nigeria and also across several countries in Africa in terms of engaging them and training on welfare principles and how it impacts, health and productivity and sustainability. We also do a lot of work around sustainable food systems, particularly in regards to climate smart interventions. And then we do work also with communities this time with training on good conservation practices and also linking to the sustainable food systems part of things. Again, like I said, everything is all related. One thing we also do very importantly is in the area of building One Health communities, doing movement building for One Health, particularly among young people. We have had training programs, for example, the One Health Advocacy and Mentorship Training. We've had the Global One Health Fellows Program, and we are currently now starting the One Health Ambassadors Program, all of which stems around building the capacity of young people within their different disciplines to be able to implement the One Health approach, to know about the One Health approach and teach them how to implement them within the context of their disciplines and also as they grow in their career. And of course, with communities come the part of innovations, which in this case would be one of which we'll talk about, which is Rore. So this is just a snapshot of some of the things that we've worked on. Of course, it's much more extensive than this, but this was the only pictures that can be able to take this for now at this time. But yeah, this it's so many of our community engagement work. Now, talking about the problems and these problems that we have seen, or these gaps that we have seen in the work that we do at OHTI, is building up to why we established Rore. The first one is the fact that we understand, this is something that everybody who has worked around the One Health sector knows, is that we have existing sector-specific health challenges in the human. I had to put it as happy because of space, but I think, it's a good acronym for this. Human, animal, plant environments. Across these sectors, they have existing sector-specific challenges. And many of these challenges are complex and they're interconnected. Outbreaks can come from the environment, they can come from animals, they can come from humans themselves, like human-to-human transmission. AMR is a deep, strong, complex One Health issue. Climate change is also a very strong One Health and also sustainability issue. All of these are very much interrelated. Food insecurity is also things that we are seeing as, very strong, that is One Health issue and requires One Health approach to solve them. Now, what we have seen is that in the course of our work is that we are seeing that there's a lot of misinformation and disinformation across communities. And this is not just, when I mean misinformation, I'm not talking about even just remote areas or underserved areas, even among urban populations. We saw how COVID came, things like Ebola, Lassa fever, where there's a lot of information going around and people just, take things off and, run along with it. The press also runs along with it, and many other things that come up after, which means that there is a gap in terms of dissemination of quality and good health information. Many times people also don't know who to trust and, who to believe or what to believe in terms of health issues, sustainability issues, livelihood issues. And this is part of the things that we have found in the course of our work. We have also found that information and also access to services is also an issue. People, for many reasons, and these are reasons that are very peculiar to LMICs and sometimes also even in high-income countries, we find out that access to services is a big issue. Access to not just any kind of service, because you can find service anywhere, maybe, but what about quality service? What about timely service? What about reliable service? What about reliable support? If there's an emergency, would you be able to quickly be able to, get information right now and, maybe see a doctor? Would you be able to see a vet when you have like urgent issues before they become outbreaks? Would you be able to get quality information as a farmer, for example? Would you be able to, quickly speak to like an agronomist or speak to, an extension worker? Are they available? How many, even if they are available, how many of these professions we have per ratio compared to the populations that we have in ground? In a place like Nigeria, for example, where there's like hundreds of millions of people, how many veterinarians are even available to attend to all of these people? How many community animal health workers do we really have compared to the large number of populations of animals that we have in the country? How do we access these services? Are they readily accessible? I mean, all of these are things that we have seen as challenges and impediments to sustainable health systems, that are holistic and attend to the different sectors across the One Health spectrum. So these are things that we have seen on the ground. And across all of these things I've mentioned, one key thing also is the fact that we have many interventions across board. We have the government doing a lot of work. We have NGOs doing a lot of work. We have donor agencies, doing all these wonderful things to be able to provide support to intervene in different health areas or livelihoods or climate change areas. But what we are still yet to really see, particularly in LMICs, is sustainability. How sustainable are these interventions and follow-up support? And this is something even we as OHT has experienced, because when we engage with farmers, when we engage with communities, we go for training, we go for advocacy, we go for, lots and lots of information sharing. We share flyers, we do engage traditional leaders, we speak with health workers, traditional leaders, we speak with government officials. We have like all these wonderful things that we do on the ground. And then once that is done, it literally just ends. Well, it doesn't fully end there, but there's a gap, because those interventions are difficult to sustain without you being there, without a form of a system to be able to ensure that there is access to such information and services over time. So when we do trainings, for example, with farmers, we see that many times after the training, they have the information and they are most likely many times ready to, adopt this information and implement them. But then there's a part of how do we follow up on them? How do we ensure that they still have access to information whenever they need it? And, they still have access to support or services when they need them. If, for example, we have vets on our team and there's probably just 3 of us, and then some of them need services urgently. We are based maybe 500 kilometers away from them, and many times they call and say, "Oh, Dr. Kiki, thanks for the training the other day, but I need help with this. I'm like, okay, so how do I help? I'm very far away from you. What do I do? But what we do usually is like, okay, we'll call up a vet. Oh, please, are you in the area? There's a farmer that needs you. Can you connect with this person? And then it goes like that. And we probably don't even know. The following up might not be so good, but there's always that thing where you need to sustain as much as possible the interventions that you are building, whether as an NGO or as any other entity that is working, or as a person who is working in the health sector. We really need the aspect of sustainability of intervention and follow support that we are providing to all of these communities. And these are the gaps we have seen, because sustainability is still something that has not been well embedded due to many reasons in many of our interventions in health, climate change, and all of these many things that we have as challenges in LMICs. And now what we have as a contributor to some of these issues as something that we know that can be a starting point to being able to meet these gaps and provide this support comes in the form of Rore. This is one tool that we have, and I will explain how this will work and how we think this can solve these challenges with health information or quality information on health and agriculture or climate smart practices, quality access to services, access to support, access to quality information and support when you need it and whenever, wherever you are and whenever you need it. So now what is Rore? Rore is an acronym for Responsive One Health Resource Engine. It's an AI-powered chatbot and a platform. Now it's a tool that starts with technology, but it doesn't end there. It's actually built by people. It works with people because we still need the human touch of things, and it works for people. So it's built by people, of course, by us who work on the team. It's built to work with people, working with people in the sense that it's built to work with people who are requesting for information or services or support, and also people who are able to provide such support. So it connects you to information. It connects you to services that you want whenever you need them. It connects service providers to people who need them. Who sometimes some people don't even know that they can be able to have so much impact with the work that they are doing because their location is limited. But by this platform, they're able to access a myriad of people who would most likely need your services. It also helps with for people. It helps. The impact is the potential impact that this can have is far-reaching because it helps to scale up and sustain many of the interventions that we have been doing. Because now we have technology that can be able to reach millions of people, thousands of people, billions of people maybe. But these are things that it's the potential for this is really limited because technology has made it easy for us. It's no longer an impediment. it's actually a tool that we can use to scale our work, to scale our activities, to improve our systems, to improve how we are able to reach our target populations. We are not all doing the same thing. We are all doing different kinds of work. We are doing some things that are very specific, like reaching like very target specific populations. Some of us are reaching a wider range of populations, but the goal is that this tool is, used as a platform. It can be able to help you to scale your reach to as many people as possible, whether if you are a service provider, that is, but for the community person, for the user who is in it, can be able to have access to this myriad of quality, validated, trusted information, and also access to service providers. So again, it provides 24/7 health information support and referrals. We did it across human, animal, plant, and environmental domains. It's validated, private, and trusted. So validated in the sense that now our validation process is an ongoing process. But what we have done so far is this. We have been able to, and this is kind of also what makes us different from every other platform like the ChatGPT and the rest of them, because every information that has been put on Rore, every response it gives to you has been responses that have been validated, that has been defined to be able to answer your questions in the best professional way. It's not just going to give you anything, from, for example, from the internet, whether it is true or not, whether it is trusted or from untrusted sources, but we've actually screened our processes. We have also, received support from researchers, from medical professionals, from veterinarians, from people who work in government ministries. We have actually had, for example, ministries in Nigeria here who have, provided support in terms of looking at the responses, looking at our prompts and responding everything and validating and saying, okay, this is not such a good answer. Let's refine it this way. Basically validating everything and ensuring that it is the correct information, it is the right information for you. And then, of course, following up, it will be the right support and referrals as much as possible. So it's validated. It's something you can trust the information that comes out of Rore. Then it's also accessible via the website and via WhatsApp. So it's currently available via website. You can use it on WhatsApp, click the WhatsApp icon and take you straight to WhatsApp. WhatsApp is one of the most, if not the most popular, don't quote me here, but I think WhatsApp is like the most utilized messaging platform right now, most utilized internet-enabled messaging platform globally right now, particularly in LMICs, maybe not globally, but particularly in many LMICs. So WhatsApp is something that we are very excited to have on Rore. And very soon we are having the part of a mobile application, and USSD also will be coming soon, because we want to ensure that Rore is able to reach even the remotest communities that might not even have access to internet connection. And these are things that we are working on to get done soon. Now, the platform architecture is, this is the website. You have the human health domain, animal health domain, plant health, and then environmental and integrated One Health. So it has all the, if you, for example, you're looking for a question that is strictly human health based, it answers you or provides support in that way. And then if you get to a point where, for example, you ask about, let's say, rabies. Rabies is not just a human health issue, it's also an animal health issue. So with Rore, you can be able to have proper information and awareness and orientation as to how the connection is there. So it also gives some kind of knowledge about One Health, because by using the platform, even though you came because, you have a question about rabies, but it also helps you to understand the context of the other factors that contributes to an issue like rabies, which is the animal health part. So, and these are the kind of, this is part of what makes it unique, because it can give you a domain specific, support where necessary. And it can also give you the larger One Health support when it is relevant, when there is a need to, when there's a prompt to do that. So it's very useful in that sense. And Rore is contributing to a world where everyone, no matter where they live, has access to intelligence and immediate information and support within each specific One Health domain and across the One Health domain in an integrated manner. So who does Rore serve? The first answer for this is you as a user, you as a person, you as a mother, a father, a young person, you as an adult, you as a family member, a brother, a sister, you as a professional, you as a leader in your society, you as a One Health ambassador, you as whatever it is you are in your capacity that you need. Rore serves everyone. You can serve anyone and anyone anywhere. And so any individual seeking health answer or support, it's available for use in that way. It's also a very useful tool for livestock farmers and pet owners. We have done, I'll talk a bit about pilots in the course of this conversation, but these are things that we have seen, this being used for livestock farmers, pet owners, in terms of asking questions about their farms and things like that. Crop farmers and agriculturists, multi-sectoral health professionals, whatever sector you work in, whether it's in the human health or One Health domain, it helps. Environmental officers, communities, NGOs, researchers, governments. If you're doing any program and if you're doing your interventions or your research or your government work, it can actually be useful for you to be able to integrate Rore into your systems. I'll talk more about that also later as to how it can help institutions like this to be able to scale and strengthen your impact or interventions across board. And also it helps the private sector. So if you have not gone to the website, you can just type www.askrore.com and log in. You can maybe try to walk around it for now. You can also scan the barcode because that takes you also directly to the website. But of course, you have enough time to do it. But feel free to start a chat with Rore because you'll be able to have an experience of what this looks like on real time. Now, what are the features? Like I mentioned before, there's the features of it has a web and WhatsApp platform, which I've mentioned before. It's also multilingual. We currently have Rore in 9 languages, I believe. Yes, we have Rore in 9 languages: English, French, Arabic, Spanish, a couple of Nigerian languages, I think Yoruba, Igbo, and Hausa. And so this is what we are starting, first of all, with this 9 languages. We are going to be building on more languages later, but these are things that we also worked around selecting, the most spoken languages, official languages across the world. Maybe not the most popular, because I know that Mandarin is the most spoken in terms of population, but in terms of the most widely spoken in terms of geographical region, of course, we have most of them on the platform, which at this time is 9. And we'll be building on this. Is a starting point, but I'll be building on adding languages as much as possible as we move forward with this. Then it has the care, what we call care structured answers. So what this means is that Rore acts as, imagine going to meet let's say a doctor, for example. You're expecting to, apart from the service is going to the doctor will render to you in terms of diagnosing whatever condition that you have. One of the things you also want to see is the attitude of the health professional. So you want to be able to say, you want to be able to see that doctor is empathetic, is very clear in explaining what the issues are to you. In some LMICs, I don't want to mention which, I know that many times we complain a lot about the attitude of health professionals. So we are very much in line with ensuring that that's not happening here. So we tend to always want to make sure that the responses are they have empathy and they have very clear guidance in providing answers to your questions. And then also now asking follow-up questions. Okay, so now that's, first of all, sorry to hear about what is going on with you. You have a headache. Oh my God, I'm sorry to hear that you have a headache. Headache can be caused by this, and this. Do you think this might be the issue? And then following up with a question like, what do you want to do next? Do you want to tell me more about why you're having a headache, or maybe what your lifestyle is? Or do you want to see a professional or a doctor? Do you want to speak to someone? It has all those, it's very systematic in the response it gives, very intelligent though. So it sounds quite human-like, but also helps to really provide really concrete guidance as to how to guide you in whatever you're doing. Then it also has these daily health tips that will be personalized according to whatever domain you choose when you sign up for the platform, because that's also something we are looking at. Then, of course, I've mentioned the part of referrals to health centers. So what we have currently is that we have integrated this geographical part of things where if you, for example, you say you want to visit a health center or a vet, Rore will ask for your location, you share it, and then it brings out a list of hospitals or vets, clinics, or whatever centers that you have within your area. Now, if you go online, if you go there now, you might not find every single thing you need, because we are still building the platform and making sure that we are integrating more things. Or maybe, for example, if you're in a country where you don't have, maybe many of your health centers are not or health centers or veterinary clinics or help centers are not exactly on Google Map, you might not be able to find all the information. But what we are now doing is that while we have the Google Map enabled location finder on what exactly can help you, we also have the part where we are building a directory of help centers, that directory of validated health centers that we know that can be able to help support and complement what's already on the Google Map enabled directory list of centers to support people in finding the right services to be able to go to. So this is also the same with professionals, because if you ask for a professional, we will be building a directory of professionals across different countries who are validated, pre-trusted, and backed by the designated authorities to be able to be available for services for people who might need them in their respective countries. There's also the part of daily log of health information. So if you go on Rore, you can be able to log health information, whether it's for your health or for your farm or for your animals. And what happens is that when you're logging all this information every week, it gives you a report based on the logging that you have done. So you have weekly summaries. You've logged, this is what you have logged this week. I think your farm is doing well, or I think there's something going on with your farm. You might want to check maybe your water quality. You want to check your feeding, check this, check that. You might want to, do you want to see a doctor? Do you want to see, a vet? Do you want to see a fish specialist to look at what is going on in your farm? So all of these things are things that it gives as backup or recommendations in terms of following up based on the daily log of information that you have given to it. It gives you back a recommendation to help you make informed decisions as to what you do with your health, with your farm, with your pets, with your cleaning your environment or things like that. And that's part of what this is meant to do with Rore. So why are we doing Rore now? I've said some things about, the fact that it's meeting gaps with access to quality health information and services and all of that. But we also know that AI adoption is growing. I really got to learn more about AI late last year. And it gave me two kind of feelings. I was amazed, blown away, and I was also scared. I was like, and this is why I had those two feelings. AI can be used for very amazing, wonderful things. But at the other end, it can also be used for really terrible evils. And as responsible people on earth, we need to be able to make sure that AI is being used for the greatest good impact it can make on our world, on our generation, for our world, for safeguarding our present, because this is happening now, and also safeguarding our future, the sustainability of our world as we see it. So having tools like Rore is actually us being able to ensure that we are guiding conversations around improving systems where we know that AI is being used in terms of being adopted as a catalyst for health improvement, as a catalyst for health system strengthening, as a catalyst for interventions in climate change, in good sustainable agricultural practices, in food security, as a catalyst for socioeconomic and sustainable development. And this is exactly part of why we are doing this now, because we need to be able to, for as many of us that can be able to have the knowledge and want to be able to use technology for good. This is one of the examples which you can look up to. And I'm also doing out to everybody who is interested in AI. There's a lot of things to learn from it, but also you need to be able to sit down and say, okay, how can I be able to use this for the good of myself, for the good of my community, for the good of the world at large? And this is actually a lesson that I want us to take from this as we move on. Now, countries, especially LMICs, need smart, relevant, and scalable tools for real-time support. I've mentioned this before that we, in many LMICs, we have so many challenges, but all hope is not lost. We just need to be able to find, the right system, the right tool, the right approach into how we deal with and how we, make our world better within the context of our work as individuals and also as a group or as people across the world. So we need this kind of tools to provide real-time support. And in the context of health, this is part and agriculture, this is part of what we have to be able to contribute to this. And again, we see that many governments, NGOs, and relevant stakeholders are already investing in One Health systems. The pandemic accord agreement was signed barely a month ago, I think just about 2 weeks ago, and it made a lot of good noise and good enthusiasm. And you know why it made that much? That's the reason why the pandemic accord made such wonderful news across the globe was because the One Health approach was well mentioned, well utilized, and well integrated. That for me is the reason why. The fact that many people are excited about One Health systems, many people are excited about investing in these One Health systems and how this can improve our world or the world as we know it. This is something that is part of the reason why Rore is important now, and we are so excited to be working on this. And again, going back to this, we need sustainability in interventions. Very, very important. Okay, so results from our pilot phase very quickly. We piloted about a month ago. May 4th or so. And this is what we have so far. So we have had about 300 plus users who have been able to log on to Rore and are using it currently. And 300 users from 22 countries in the world. I was really amazed about it. I was really happy to see the geographical reach that we've been able to have people, log in and use it and who come back to use it almost on a daily basis now. We have also been able to validate content. Now, again, content validation, like I said, is an ongoing process. It's never going to stop as long as Rore is there. And this is the beauty of our work. We're going to continue to review content as much as we continue to have new content being pushed out and published every single day or every single, hour, second, minute. We will continue to validate every content that we have on Rore. We are validating content for different reasons. We're validating content for veracity, to be sure that it is aligning, it is quality, professional advice and information. We are validating content to be sure that it's aligning with the context of your locality. So what you will find, the kind of support you would find in terms of access services, for example, in, let's say, the US, you will find something, of course, it's the same idea of providing access to quite, but you find something quite different in a place like Uganda, because there are different situations, different contexts of things. You find a variation in India, for example. So we're ensuring that the content is aligning with each country's or locational priorities. What are the common diseases in your area? What are the common NCDs in your area? What are the common animal health issues or the common, what are the kind of crops, for example, that you have in your area? What are the kind of environmental or climatic issues that you have in your area? All of those are things that we are validating those contents for. So even as we continue to move from country to country in engaging with partners and stakeholders and governments in adopting Rore, we are going to be ensuring that at every stage in time, there is somebody on the team that is working, as a representative from each of these countries or governments and validating this content across all the domains. One person per domain, not one person for all domains. But there's somebody who is validating the content and all of that. We're able to provide support with that. And I'll talk more when I'm talking about stakeholder engagement for this. Then we've also had a number of people also, request for consultations. So we have an in-house medical officer. She's doing a great work with this. And also, of course, we have quite a number of veterinarians within. I'm a vet, so I've also been able to provide support with consultations. So in the last 1 month, we've documented 11 consultations in both the human and animal health sector for people who have sent a WhatsApp or called me and say, oh, doctor, there's something wrong with me. I need this, I need that, I need your help. And then when we provide the first line of consultation, we then refer them. For example, it's a thing that requires them to visit a health clinic. Okay, so go to this clinic, or you need to do some tests, and then there's always we refer them to the right places within their locality so they can be able to follow up with support that has been given to them. And of course, there has been also follow up on what the results were with the doctors in the centers, and also circling back to us where necessary. So we've done 11 consultations the last 1 month, and then we have, like I mentioned, we have 9 languages that have been included that people have used. And also another amazing thing which I've not mentioned is the fact that you can actually speak to Rore, use the voice function. It's called speech to text. So you can press the voice function and then you speak to it and then it converts to text, and Rore can answer you back in that way. So that's also possible on the platform. So some of the feedback we have received so far, we have very impressive, innovative, provided great answer for my case study, great work in progress, fascinating, a One Health companion. I tried the tool this morning and got a good robust answer to my test question. So we've had, quite some nice feedback on Rore so far, and we're happy to see this, as we continue to grow in this. Of course, much more than this, we have actually had also many people reach out to myself, members of the other team, sending personal messages, and I mean, so it's so heartwarming to see the positive and the constructive criticisms, because that's also has made us to, tweak things, to improve things, I know how many sometimes myself and our developer, we are talking late at night, okay, this is not working, this is giving a wrong answer, this is not good. My team and I, we have continuously been doing iterations of refining things at the back end. And this kind of feedback is what has helped us, both the positive and the negative, helped us to improve. And this, I want to believe, will continue over time, because we welcome all kinds of feedback, because that's what makes us happy with what we do and also, be better at what we do. So now, how can Rore support you? How can it support you? Very quickly, it can support people and communities. I won't dwell too much on this because, I've talked about, on-demand support, digital inclusion, multilingual access through WhatsApp and the SMS, local relevance, because it delivers tips and alerts based on your region, region, access to professionals, we've mentioned this already, and then daily, weekly tools for record keeping, symptom logging, and learning as much as possible. Now, for government agencies, how can Rore help? Rore can help with localizing information that, if, for example, there are some interventions you are doing that require health information, you can help communities get answers. It can act like a first line of information before now referring people to when they need to visit a clinic. Like, some people just need information like, oh, my wrist is paining me, what could be wrong? Or I have a sore, what could be wrong? It's not everything you want to, go ahead and go actually have to visit a clinic and do all that, but at least that first line of quality information that is reliable and that can also be able to speak to a professional immediately is a kind of what can also happen with Rore. Public engagements, you can integrate into existing interventions, facilitate communication and support guidance or behavior change on things like AMR or climate change and things like that. It can also help for disease surveillance in terms of anonymized user reports and trends that we can find based on what people report on the back end of Rore. It can be able to use that as a tool to be able to say, okay, there's something going on here, disease surveillance, or what are the trending disease or trending requests or trending queries across domains that is important. It can also help with strengthening referral systems when it comes to access to government hospitals and digital triage in terms of referrals to whether a laboratory or hospital or as much as or different health centers or mental health support and things like that. And of course, it's a very good tool for modernizing or improving service delivery in health and agriculture. Now, for NGOs, Rore is a very important tool because with Rore, you can be able to scale your messaging and behavior change interventions. When you do your outreach to communities, to people, these three things that have been outlined here, Rore can act as a two-way communication. NGOs always, of course, they reach out to their communities, they reach out to their target beneficiaries, and of course, they also need to continue their services or sustain their intervention. So Rore can be used as a tool to be able to ensure that people are reaching you through Rore, because with Rore you can be added to the directory of maybe centers or maybe whatever service you provide. So your target communities can reach you and you can also reach your target communities. So it's like a two-way communication with target beneficiaries where you can also scale if you have like an important message you want to give to, maybe there's certain messaging you want and behavior change intervention you are doing, it can be well integrated into Rore. If there's a campaign you're running like a WASH, AMR nutrition, or you can support thematic programs, it can well be integrated into Rore. It's flexible like that. And then it also acts as referral and service access. I've mentioned this because with Rore, we can be able to add you to our directory where, of course, we'll have to go through a process of validation first. But once we are validated, we can be able to have being part of service providers that people can access for your facilities, for your services, or for the work that you do. And then it can also act as a tool for monitoring and evaluation. Then for donors and partner agencies, this is something you can invest in as a growing platform with local ownership and global potential. Of course, the potential reach is global, but everything at every time is adapted locally. We're not going to give any blanket information or blanket support to just anybody. We have to tailor it based on, if you even log on to Rore, we will see a part where it's asking for information such as what's your country, what domain are you most interested in. It has some basic information because it wants to tailor responses and support to your own personal individual need. So it's also an opportunity for high visibility for donor and partner agencies in terms of when you partner with us, then field implementation can also be supported or improved because you can use Rore to deploy your global One Health goals and your SDGs. Then it acts as a tool for capturing grassroots realities and needs. And if you're seeking for partnerships for things around disease preparedness and digital health projects, this is a very wonderful opportunity for you to be able to make use of Rore and see it as a viable tool that you can use to implement some of your interventions in these areas. And of course, it's adaptable to LMIC context and languages. Private sector, of course, and in this case, I'm talking of particularly for farmers, pet owners, health seekers. This will be great for you. We can support to, co-develop solutions for health agriculture, CSR, brand visibility. So for many private sector or industries who are running CSR programs, this is an opportunity for you to use Rore as a platform for you to be able to demonstrate and implement your CSR goals and achieve your CSR goals, especially when it comes to the potential of reaching more and more people within the context of the work that you are doing or the CSR goal you are achieving. Media and influencers. So Rore can act as a good source source for validating information. If you have something, I know many times in the media, there's always a gap between professionals and then the media professionals, because professionals are professionals and they're experts at what they do. The media, their own is to relay information and to share it to the world. They might not necessarily be professionals in what they do. In fact, many times they are not professionals in the topic they are speaking on. So what happens is that for sharing, disseminating information or good or quality information, you can use Rore as a source to be able to validate or be able to ensure that you are passing the right message across to people, to populations, especially when there are issues of public health crisis or climate crisis. All of these things are very important. So it helps to generate shareable, credible health and farming content. The information you get from Rore is expert backed, so you are covered in that area. Of course, opportunity for partnerships and community interaction, particularly with your population, whether it's radio or newspaper or social media. This is an opportunity for you to be able to provide good educational information that that can help people across board. This is a journey and it's not a marathon. Okay, so you can see that this is AI. So I wanted an AI generated, picture that shows this. This is actually AI generated. And I put in, give me something with the caption, this is a journey, not a marathon, and give me this. So you can see that this is not exactly a perfect wording. I was going to do something different, but I was like, let me just put it here because for me it was a message. What we have here is a framework. We will continue to improve over time. We'll continue to strengthen the framework that we have. We have a baseline. We have something that we have validated, we have piloted, and has proven useful. And it might not be perfect now, but this potential and the scale of impact is amazing. Now we see the future and we see the fact that it can be able to make a change in the world that we live in terms of access to health information, access to quality services, and helping people to access, services in a very timely manner and a very credible manner. This is something, we might take some of these things for granted in high income countries, but in LMICs, it's a very big issue. And it's part of, when you talk about mortalities and morbidities, it's because of things like delayed access to health information and services. It's part of what causes many of these things, whether it is in humans, whether it is in animals, or even with the plants. When you don't know something, you're not able to adapt your behavior or be able to make informed decisions that will probably help to, curb the situation on ground. And this is what we are doing. We are thinking long term. We are thinking decades and decades and decades to come as to how we can continue to improve access to health services, information, and all of these things. And this is why we say that it's a journey and we are ready to go all the way because, first of all, it's embedded in our work as OHGI. Second of all, it goes beyond OHGI and can actually help other people, other institutions, other establishments, other frameworks that we think that can be helpful for this. And lastly, I would like to give a special shout out to my team who we have been working together on this. And thanks to everyone. I hope I've captured as many people as worked on Rore with me here, but you can see it's been a privilege leading all of you in building this, putting this together and out for the world to see and to use and to see how it grows from here. But thank you to every member of my team who has, worked on this with me and who has been amazing in the collaboration that we have all done together. Thank you all so much. So at this point, I want to say thank you for listening. Thank you for the patience in, sharing this and listening to this. And please feel free to follow Rore on all social media platforms like you see here. Over to you, Alex, for the question and answers. Thank you, everyone.
Thank you very much, Dr. Kiki, for this presentation. If you have any questions, I know a few have asked a few questions that I'm currently trying to answer. But if anybody has put any questions in the chat box, please can you put it in the Q&A? That way myself or Dr. Kiki or Dr. Abdullah could answer it. Whether if you have any questions about the platform, the vision behind the Rore, or how to get involved, we'd love to hear from you. So Dr. Kiki, I don't know if you have access, but there's a couple questions.
Okay, please ask it because I'm not sure I can access that from where I am now because I'm sharing my screen. Go ahead.
That's all right. So we have a question here. How do you plan to be getting feedback from Rore users to be able to improve on customer user satisfaction?
Oh, yeah. So we have a form on, maybe we should have shared the demo of the website, actually. We have a form on let me just share my screen and get it on board here because I think it's more helpful in that way. So this is the platform on the website. And let's say, okay, I can sign in with Google, which I will do, or through this or create an account. So, and by the way, maybe to also mention very quickly, it has a night and day version. So if you're a bit photosensitive like I am, I usually prefer the night darker screen version of things because of my eyes. So I'm signing in, but let me make it brighter because I know that not everybody is like me. So yeah, okay. So at the home screen, or even on the chatbot, once you use the chatbot and say, let's say I'll just use headache because headache is like one of the most common things that many of us complain about. I have a headache. What do I do? So then, it responds. And then there is, once you respond, if it gives you like 2-3 responses once you're chatting with it, it can actually, there's a part where it asks for feedback. So if you give 1-2 responses after you have chatted with it for a while, it asks for you to share its feedback. Or you can go to the home page, and there's a feedback form here that you can use. This one is a much more detailed feedback form, apart from the one that just have the thumbs up or the thumbs down. So for those who are interested in sharing like a much more detailed feedback, please feel free to use. It's not loading. Probably my internet. I don't know why. But this form here is a more detailed feedback form that you can use to share your feedback on how Rore is doing, or what you think can be improved, or what you think can be of help. The other option is that you can also go ahead and send an email to rore@moneydev.org, and we'll respond to you immediately. I don't know why this form is not opening, but team, we need to address this. If it's not my internet, we need to address why this is not opening. I hope that answers your question.
Okay, so second question here. So great platform, great presentation. Thank you. On behalf of Dr. Kiki, what specific measures does Rore implement to ensure the privacy and security of user data?
Yeah, so first of all, we anonymize data. And in terms of whatever data, in terms of the queries and everything, we don't store anybody's personal information like names and things like that. And data, so we already have a system where all data is anonymized. And we also don't share data. We don't sell data. So I think everything is included in the privacy policy and terms of service. So whatever data is collected at the back end of the platform is focused to use for our M&E, first of all, and also to be able to use as, in case there are any health reports or things that we think should be notifiable to the government, for example. I think this is also something we also want to be able to use Rore to do, so that in case there are anything that we see like a spike in queries on this or information on this, we can be able to, act as a tool or a contributor to disease surveillance mechanisms or systems in communities and for governments. So for the data we ensure that all data is stored in secure platforms at our back end, and all data is anonymized, is not identifiable in any means. And you can read more about it in our privacy policy and terms of service here.
Great. Another question. So during the presentation, you had mentioned that Rore will bridge the gap for individuals. It doesn't just stay at being a virtual platform. How do you intend to integrate local service providers in the locality of users?
Okay, so we've already started doing this for Nigeria. And again, Nigeria, because that's where we are based, but we are working based on the opportunities that are presented with us now. While we are working in Nigeria, we currently have a project that is running in about 7 countries in Africa. And also we have some of our staff working in India currently. And we are looking to see how to explore opportunities with, service providers, NGOs, government institutions in all those countries. So what we are doing is that before we do anything, before we work in any country, even including Nigeria, we first of all start with the stakeholder mapping. Who are the key actors in governments, in civil society, NGOs, in the private sector, in research? Who are the key actors, whether institutions or persons? So we want to identify our stakeholders first, and then we ensure that we of course contact these people or institutions, get in touch with them. For the countries that we are currently looking to work, we already have focal persons in all those countries. So we already have a local actor who is working with us in that way. For service providers in this area as institutions, once they are validated, and validated in the sense that validated to meet our own requirements, and validated to ensure that they are government-approved institutions or government-approved professionals. So they will be included in our directory of professionals or help centers or institutions or health centers and things like that. And then they can be added to the directory. And when people need to, if anybody makes a request that, I need to see a professional in this, or I need to visit a health center, or I need to do this, then it comes out. Our directory brings up the relevant information you need that is available within your locality, and then it helps people in that way. The other thing is that people can also say they want to reach out to us directly who work to man the system, and we can also help them with providing that support. So they don't necessarily have to just depend on the AI to bring out information for them. But they can also reach out to and say, okay, I need somebody in this area. Can you please help me to find? And then we can do that for them from our back end. So that's not a problem. But we have that system. We already have a framework for ensure that we identify our stakeholders, validate them, and ensure that they meet our requirements and also meet the government approvals. And then before now adding them onto our system.
And there's just one question left. Is there any future plans to make Rore a subscription based for users and service providers?
Yes. So the features we have currently will be free for use. However, because we are still working on we will be adding some more features to it that would need subscription, which is needed to be able to maintain the platform, to make sure that it's sustainable, it's running well, and ensure that it's also providing value to people who need them. We'll have, of course, the features that will be free for use and free for anyone who wants to use it. But as we add some features that are coming up later, I've not mentioned many of them here. Some features that are coming up later, there will of course be a subscription base for it, and which will be ensuring that it also helps to sustain the platform over time.
Okay, doesn't look like there's any other questions here. All right, then I don't want to keep everybody too long, so I think we'll just wrap up the presentation. Thank you again, Dr. Kiki.
Thank you.
So I just want to say, thank you all so much again for attending the official launch for Rore, also responsive One Health resource engine. Just to kind of sum up that, Rore is it's more than just a digital tool. It's a movement towards trusted, multilingual, real-time support that meets people where they are and when they need it at most. Whether you're a healthcare worker, a researcher, a policymaker, a community member, or a partner organization, Rore is built to serve you and to grow with you. As we officially declare Rore open to the world, we invite each of you to become part of its journey. If today sparked any ideas, questions, or opportunities, we encourage you to try the platform and share it within your network. Reach out to us if you're interested in partnering with us. We're actively welcoming collaborators. Stay connected through our website and social media. And as I mentioned earlier, we are recording today's session, so we will be sharing today's recording and the highlights and the next steps via email and on our platforms. So keep an eye out. Finally, on behalf of the entire Rore and the OHDI team, thank you again for your time, your energy, your shared commitment to a healthier and more connected world. This is just the beginning, and we're so excited to have you on our journey. Have a wonderful day. Bye, everybody.